Good morning, ladies and gentlemen. Thank you for being here so early in the morning. And thanks, Dr. Kiran sir, for inviting me here at the second PPF greetings from my hometown, Agra, again a tier 2 city, like Dr. Ashish said, and my alma mater, Armed Forces Medical College, Pune. Today, I am not here to give a talk. I am here to convince you all. Even if I can convince 5 people in this room, my talk will be successful. Listen. Private insurance companies, what are they doing to our healthcare system? That is the talk of the point of talk, and how they have destroyed the doctor-patient relationship. I'm sure most of you have watched the series Game of Thrones. This is just like that. There are 4 players in this: the doctor, the big pharma companies, insurance companies, and the medtech companies. These are the 4 players in trying to capture the throne of healthcare. So what was the turning point? It was 1975 when the US Supreme Court ruled that medicine was no longer an insulated profession. Rather, it was a commercial business. It was till that point of time, the doctor was at the helm of affairs and he was sitting on the throne for centuries. Then came the rise of managed care, the corporate middlemen, specifically the insurance companies. Look at the term which AI has used here. I have drawn this from the latest AI search. Corporate middlemen, insurance companies have been called that. They took the power of the purse and the decision making away from the primary healthcare giver, which is you, the doctor. And then followed the era of unemployed doctors from 2000 for employed doctors from 2010 to till date, which means a shift in rules. And in the US today, a staggering 82% of the doctors are working under an insurance company. They are being paid by an insurance company, not a hospital. India has still not reached that stage. So let us see how an insurance company grows. First, they will sell security of health with petty premiums to patients. It is a fear-based selling. Next, they gain a wide public following. Third, then they approach hospitals for empanelment. Then they clear hefty and overinflated bills smoothly, without any hassle. This I am talking about the initial phase of an insurance company, how it develops. Initial 4-5 years. Make the hospitals and the insurance companies and the patients think that they are good for them. Now starts the real game. Start rejecting claims, deducting from the full amount which the hospital presents to the insurance company. Make the hospitals and the patients beg for their genuine claims. Next, start dictating terms to hospitals, doctors, and government agencies even. This is the stage where India is right now, currently. Next comes buy out the hospitals and control the salary of doctors and staff. I think this has happened already in some tier 1 cities, not yet in tier 2 cities. But in US, it has definitely happened. Control the government policies directly by supporting them financially and by winning elections. Like in the US, there's a company called United Healthcare. It is the kingmaker, believe me. It controls all the government policies which are there regarding healthcare. Then we come to what is the root cause of inflation in healthcare. Is it the doctor's fees? I don't think so. So the three big players, the big pharma, medtech companies, and the insurance companies. I still believe that the pharma companies are providing medicines, they are manufacturing, they are giving us a product at least. The medtech companies, they are giving us microscopes, they are giving drills, still acceptable. What are the insurance companies giving us? What real product are they giving us? I think it is nothing. They are just selling fear. What is the impact of this? We have been talking about rising costs, rising healthcare costs, procuring equipment is costly. Why does this happen? The root cause is insurance companies. Why do you think packages in tier 1 cities and tier 2 cities are different? They are set by the insurance companies. An ophthalmologist operates on a cataract in a tier 2 city versus a tier 1 city. Is the management going to be any different? No. Then why the packages will be different? So today, suppose a procedure costs 5 lakhs. In next 10 years, it will cost 15 lakhs. And in 30 years, it will cost 1.5 crores. That is the amount of inflation in the medical industry. It is nearly 20%, which is much more than the average inflation, which is 9 to 10%. Then how insurance companies have damaged the doctor-patient relationship? The ideal medical bond is of trust between the doctor and the patient. We all have experienced this. We know that if a patient who comes in our OPD does not trust us, he is not going to get good outcomes. We have all experienced that. So how did the insurance company fracture this bond? By asking stupid questions to us. Why do you want to do this surgery? Why do you want to give this medicine? I don't think has the power to ask a neurosurgeon, why do you want to do thrombolysis in a stroke patient within 4 hours? So when the company asks such a question and we are the ones facing the patient's mind goes in a direction of mistrust towards the doctor. He thinks that the doctor is doing it unnecessarily, which is not the case in most of the things. So this is how they fracture the bond. And the end result, the patient is always hesitant and skeptical towards the treatment intentions of a doctor. And the doctor is risk averse, very cautious. He doesn't want to take up difficult decisions which could save the life of the patient. So I'm very fascinated by this fellow. He's an American ophthalmologist who has made an entire career out of making satirical videos on American healthcare system. So this is a video. This is a employee of United Healthcare. He is taking interview of a doctor who he wants to hire to make policies for their company. So just listen to them, what they're talking. This is a satirical video.
Do you keep up with the latest medical advances?
Absolutely not.
How's your empathy? Non-existent. A neurosurgeon requests prior authorization for emergency removal of a brain tumor. How do you respond?
We'll get back to you in 6 to 8 weeks.
Here's a claim. Review it. Denied.
Don't you want to look at it first?
No.
So he has this interview. He doesn't want to look at the claim which is being presented. This is the actual scenario in the US. I know it personally because my mother's sister, she lives there in Los Angeles, and my two mamas live there in Texas. So the American healthcare, I think it's a bit personal. On 13th of July, this this month, my mother's sister got operated for breast cancer in Los Angeles. She was not allowed to take opinion of a oncosurgeon, a specialist oncosurgeon, just because her insurance company does not cover it. She was forced to go to a general surgeon and who was trained in breast cancer surgery but not a proper oncosurgeon. So this is what the American healthcare system has come to. I don't think we want to see such a future. We all know this. The United Healthcare CEO was shot point blank in 2024 on December 5 and he died just because they rejected claim of a person whose mother was suffering from cancer. So who needs a health insurance? You will say the poor and elderly need health insurance. My dear, they don't have the pocket to pay the premiums. Patients with specific chronic kidney diseases or cancers, they need health insurance. Yes, maybe, but that percentage is very less out of the total number of patients. Third, you may say practically everyone needs a health insurance. I don't agree. My answer is no one. I'll just take 1 minute more. I'll give my own example. I forgo my Star Health policy last year in July 25 for my whole family, including my mother, father, and my wife. So what happened after that? My father got admitted at Medanta with a myocardial infarction in November 25. Now look at so I paid in cash, of course, since I had no policy, which I had been paying premium for last 5 years. Total stay was 4 days in 2 admissions. He got stenting in both the arteries, and total expense was 9 lakh rupees, which I paid in cash out of my pocket. If I had insurance, the total bill will be overinflated, of course. It will be 16 to 17 lakhs, plus I would have to forgo my practice for 7 to 8 days because they won't discharge me immediately from the ICU like they did. Still, I have to pay 8 to 9 lakhs from my own pocket because my insurance cover is only 10 lakhs. Then what is the point of it? This is just one example. Many other diseases might not conform to this. So can we come to the solution now? Yes, we can. I appeal to all of you to ban cashless facilities, like it was done in Ahmedabad by the Ahmedabad Hospital and Nursing Association on 2nd of April 2024. They banned cashless facilities for 3 major insurance companies and they stood by their decision. And within few weeks, the insurance companies were brought to their knees. Solution: control your own emergency fund. Invest in equity mutual funds. Control your money in your own hands. Don't give premiums to these middlemen. It is just a black hole where you are putting your money in. It is not only about finances and power. It is about the ultimate care which I will receive 20 years down the line when I am lying in ICU bed under a neurosurgeon. What care I will receive depends on the quality of doctors, not the building, not the insurance. Who is treating me? That is the point. If you want to see doctors again sitting on this throne of healthcare, it has to start with us, the neurosurgeons. We are at the helm of this medical society. Thank you so much.
Thank you so much, Dr. Neeraj.